Hey everybody, it's Meredith with EmpoweredMochaPatient.com, and today I'm being joined by Dr. Krishna Upadhya. She is an adolescent pediatrician, and we're just doing a little Google Hangout to share some information. We're going to talk about an article that I wrote that was featured on Blog Her about a news report that came out not too long ago suggesting that the current HPV vaccinations may not be as effective for Black women as we originally thought. And we're going to talk about the current guidelines for the HPV vaccination, as well as some adolescent health issues. We do have a little bit of technical difficulty with the audio. There is a little bit of echo, but I encourage you to stay and watch until the end because Krishna has some great information to share. So we're going to go ahead and get started with the first question, Krishna. And what is your opinion of the recent study that was published by Dr. Catherine Hoyo of Duke University that concluded the vaccines currently available for HPV in the U.S. do not protect against the strains that are most common in Black women?
So thanks, Meredith, for setting this up. I want to just make clear that I have read reports of the study that you're mentioning. The results were presented at a national meeting recently, but they haven't been published, as far as I know, in a scientific journal. So I have relatively limited information about the study, and in order to really judge the results. But I do think that there are some things to be cautious about when interpreting this, and especially in the way that the messaging about the study has come out. First of all, I think it's really important to keep in mind that the study is based on a small number of women, so only 572 women were reported on. We don't know many characteristics of the women. In the reports that I've seen, they talk about the race of the women, but don't talk about any of their other characteristics. So it's really hard to judge how these women, how similar or different they might be than women in the general population. The other really important thing to know is that the women that were in the study were all recruited from a clinic where they had been diagnosed with an abnormal Pap test. So that makes this group of women, again, different potentially from the general population of women who are recommended to get the vaccine. So I think it's really premature, based on this report, to say that this vaccine is not effective for a whole population of women. I think we know for sure that the HPV vaccines that are currently available only cover a small number of HPV types, so that's definitely a limitation of the vaccine. So the vaccine types 16 and 18 cover what we know to cause 70% of cervical cancers. So we know already that it's not covering all cancers. So it's certainly reasonable to say it would be good if we had vaccines that covered more HPV types, and that would be better. And so I certainly hope we do get those vaccines. But I think we also need to keep in mind that African-American women are more likely to get invasive cervical cancer and more likely to die from it than white women. And so I think we have to be really careful before putting out a message that the vaccine is not effective for those women, because I don't think that that's what the information that we have is. And I would hate for women to not get a vaccine that could be potentially, life-saving because of a preliminary report like that.
Okay. So basically, it's too early to make a judgment call about whether or not it's effective. Thank you for answering.
Right now, I think that it is an effective vaccine for the types that are covered, and so I would encourage people to get the vaccine.
Okay. And what are the current recommendations for the HPV vaccination?
There are currently two types of HPV vaccination that are licensed for use in the United States. The first is what we call a bivalent vaccine. That means that it covers two strains of HPV virus. Mm-hmm. And the other vaccine is what we call quadrivalent, which means it covers 4 HPV types. So the recommendations are a little bit different depending on the vaccine. The vaccine that has 2 strains of HPV, the bivalent vaccine, is licensed for use only in young women, whereas the quadrivalent vaccine that covers the 4 types is licensed for males and females ages 9 to 26. So the current recommendation is that all females be vaccinated against HPV at their 11 or 12-year-old visit. and that they complete the vaccine series, which in either case is 3 doses over 6 months. Another important thing to know is that if someone is late, like for the second or third dose of the vaccine, they don't have to restart the series. Okay. So sometimes parents, ask, what if I can't come back, in 2 months for the second shot? Does that mean that my child has to start it over? And the answer to that is no. So once you start, it's just 3 doses. And then the recommendation for boys is that they receive the vaccine also, the quadrivalent vaccine at their 11 or 12-year-old visit, and that they then complete the vaccine. And then for boys or girls who didn't receive the vaccine at 11 or 12, they should get what we call a catch-up vaccine, so they should be vaccinated, sometime between then and age 26.
Okay. And so the vaccine is approved for both boys and girls, so why should parents strongly consider vaccinating their sons?
So, when the vaccine first came out, it was marketed for girls only, and it was approved for girls only, and that was for protection of cervical cancer. We know that boys cannot get cervical cancer, so prevention of cervical cancer in their sons is not the reason to get the HPV vaccine. However, the quadrivalent vaccine, as I mentioned, it covers 4 HPV types, and 2 of those types are associated with genital warts, which can affect boys or girls. And also, boys are at risk for other HPV-related cancers, including anal cancer. So reduction of risk of anal cancer is another reason for boys to get vaccinated. Some people think that, it's not hard to convince people that getting a cancer vaccine is important. Some people think genital warts, isn't as important. But I would say as a medical doctor, even though genital warts won't kill anyone, the effects of genital warts on a person's quality of life can be quite significant, and they can be difficult to treat in many cases. And so, from my standpoint, if I can prevent genital warts in a patient, I think that's also a very important benefit.
Okay. So HPV is commonly associated with cervical cancer, like you already mentioned, but what other types of conditions has HPV been linked to?
So HPV is linked with genital warts, as I mentioned. In women, it can be associated with cervical cancer, as well as vulvar and vaginal cancer. It can cause penile cancer in men. It can cause anal cancer in men and women. And then more recently, we're recognizing that a lot of oropharyngeal or head and neck cancers are also HPV related. The vaccines have not been studied in terms of their effectiveness at preventing head and neck cancer, so we can't tell people that you should get an HPV vaccine to prevent head and neck cancer, but HPV has been associated with those cancers. Okay.
So let's switch gears a little bit and talk about things from the adolescent pediatric or pediatrician perspective. What advice do you have for parents on teens talking to their teens about sexual health?
So the first thing I would say is that parents should definitely talk to their teens about sexual and reproductive health, because we know that unfortunately a lot of young people in our country are at risk for really bad reproductive health outcomes. We have still too high rates of sexually transmitted infections, HIV, as well as teen pregnancy. And so I think it's definitely something that parents need to talk about with their kids. I think that it's important for parents to keep in mind that sexual development, sexual feelings are all normal parts of being an adolescent, and so it's important for us to talk to kids about those feelings and help them sort of navigate what to do about them. I think it can also be helpful to have a doctor or a pediatrician or an adolescent health doctor who is really comfortable talking with teens and working with teens, maybe who has special training or expertise in that, because I think those people can really help parents facilitate conversations and can also provide safe spaces for teens to ask questions.
Okay. At what age do you recommend that adolescents start to pay attention to their body developing, like how their anatomy looks, maybe how things smell? Is there anything in particular that they should be paying attention to?
So as pediatricians, one of our key areas that we focus on is something that we call anticipatory guidance. And that basically means that we like to talk to parents and kids once they start getting old enough to kind of participate about things that they should expect sort of in the months or year ahead when they're at their checkups. And so one of those important areas is really puberty and all the changes that go along with puberty in terms of the body changes. So if we think about when puberty starts, and I think we've probably all seen a lot of reports in the news about the fact that puberty might be starting earlier. I think it's good for parents to keep in mind that some girls might start developing as early as 8 years old or even a little bit earlier than that, and that would be starting with breast development. And boys may start developing as early as age 9. And so, keeping those things in mind, it can be a time to at least start making your kids aware that these kinds of changes might happen. The other thing I think it's important for parents to do is to start conversations, but also pay close attention to what their cues from their kids about what they're ready to talk about. So younger kids may not be ready for all the information. They might need different information. They might need it in smaller doses. And I learned this firsthand recently because I have an 8-year-old daughter who was going to a birthday party for her friend who's turning 9, and in my adolescent head thought, I should really make my daughter aware of the fact that she might start noticing, maybe some of her friends are going to start having breast development, maybe she's going to start having it, and I should talk to her about that. And so one night when we were, reading a bedtime story, I tried to bring up that conversation with her, and, she listened to me really quietly and then said, Mom, can we not talk about this anymore? And, and I, and so I said, sure, that's fine. I just wanted to make sure that she knew that she could talk to me about it. And I think at least I know that I sort of opened the door. I think parents can do that, sort of open the door so that your kids know that it's something that they can talk to you about when they're ready. But, don't try to force them to take in too much information if it's not something that they're ready for at that time.
So what are some good ways to help parents facilitate the conversation? Are there any books or websites that you would recommend them to refer to?
I feel like I'm sure there are some great books out there. I don't personally have any books to recommend. I do use some websites. So one of the websites that I use a lot is called youngwomenshealth.org, and it's maintained by the Center for Young Women's Health at Boston Children's Hospital. And they have a lot of really good health information on a variety of topics that's really written for teens, but also they have a very good section for parents on a lot of different topics. So I would recommend that one. The Society for Adolescent Health and Medicine also has a website, which is adolescenthealth.org. They have some links and some resources there, and they also have a link to help people locate an adolescent health provider in their area. So those are two that I definitely would recommend.
Okay. So how often should teens be visiting the doctor for wellness visits?
Definitely we would recommend a wellness visit at least annually. In some cases for kids that have specific health needs, we might recommend more frequent visits, but definitely they should have a visit every year.
Okay. And my last question is, are there any tips on how parents can assess whether or not their teen may have some underlying health or wellness issues, such as they may need contraception and be afraid to ask, or at risk for exposure to an STD, or dealing with depression issues, possibly bullying at school? How can they assess those situations?
So I think that, really parents know their children, better than anyone, because they, have seen them grow and they spend a lot of time with them. So I think, keeping in mind that if you notice significant changes in your child's behavior, maybe they all of a sudden have completely changed all their friends, maybe they're totally uninterested in doing things, it's hard to get them out of bed, those kinds of, significant changes in behavior, I would say can certainly be a sign that something is wrong, and that you should seek help. I think it's important to, really ask, sort of keeping open dialogue with your teens. Other parents of teenagers have told me another really good time to sort of figure out what's going on with your kids is to drive them places with their friends, because then you're kind of in the car and you can listen to the conversations that are going on and then get a sense of some of the things that are going on. That can also be a good time to talk to your kids, because they can't get away from you, but they don't have to sit like staring at you. So I've also heard a lot of parents say that that can be a good time to have some, conversations that maybe seem a little bit awkward, but, um, you know, that are important to have.
Okay. Well, you gave a lot of good information, Krishna. I really appreciate you taking the time to speak with me.
Thanks for setting it up, Meredith. It was fun.